We've got the lateral side, which is biceps femoris. Biceps, what does it mean? Two heads. Femoris, femoris, of the leg. So that muscle shares the same origin as all of the others. We remove it, we can see there it's coming from the ischial tuberosity, so that part of the pelvis, and it comes all the way down, splits into two heads. We've got the long head and the short head, and inserts the long head onto the head of the fibula, just there. So we can see from that it crosses the hip and it crosses the knee, and it's at the back of the body, so it's going to extend the hip, and it's also going to flex the knee. It will contribute as well to lateral tibial rotation. So it's going to slightly rotate that knee depending on the levels of flexion there. It doesn't just do that, it's going to posteriorly tilt the pelvis as well. So that's something that can contribute to postural factors, possibly in my experience affecting low back pain. So that's the one. Now let's have a look at the other two. These two we call the semis. So they're two parts of one whole is how I like to look at it. And not really very well illustrated here, but the name gives you a big clue as to how they actually look when it comes to real life human anatomy. So when you see it on a cadaver, you'll be able to tell which one's semitendinosus because it literally looks more like a tendon. Semimembranosus looks more like a membrane. It really does as well. It's more like a sort of thin film. I mean, it's still quite big, but compared to tendinosus, it's very different. And so these two, then you can get an idea of how they work together. And they're really, I view them as part of the same muscle. So they, just like biceps femoris, come from the ischial tuberosity. So look at that big old fat tendon there, the hamstrings. You can imagine when that thing goes. They come down to the medial aspect. So they both insert onto the tibia, and you've got semimembranosus attaches onto the posterior. You can work it out. It's the posterior aspect of the medial condyle of the tibia. So there's a lot of words for you, but let's actually break it down. Posterior at the back aspect, where it is. Medial, inside, condyle, sticky outy bit of the tibia. So there you go. And then we've got semitendinosus, which still wraps itself around medially, but just comes a little bit further around to the side of the knee. That inserts on the proximal medial shaft of the tibia. We call this the pes anseri. So pes anseri meaning goose foot, geese have three toes, and we have three muscles that insert into this tendon here, which we can talk about another time. So these two semi-muscles are going to do more or less the same thing as biceps femoris. They're going to act slightly different on the hip because of their location medially. They're going to assist in medial hip rotation and medial tibial rotation. But crucially, they're all going to work together to posteriorly tilt the pelvis, to extend the hip, and to flex the knee. And they're supplied by the sciatic nerves. That's the hamstrings group.